Okay, this is a pitch basically on prevention, or that grey area between prevention and minimal invasive dentistry, which I've always been interested in. And this is the problem. Every year it gets worse. We all know that the highest number of admissions for people into the age of 19 is for tooth extraction. And so this is what we're trying to reduce. So this is a couple of pictures that I took just before I went to a meeting yesterday. And one is the product that I recommend, and one is a couple of cameras. Well, there are 3 cameras if you include the iPhone. But these are intraoral cameras that you can buy yourself. And the idea is about teledentistry. And there's some disclosing tablets and mirrors and cheek retractors. But this is about getting access to schools. And what we want is to get people in there who can actually just apply the paint onto the teeth, which is called silver diamine fluoride. And there are quite a few of these online courses that nurses can go on. And even though they're online and distance learning, as you can see, they're able to do the fluoride varnish course and oral health education. The impression taking, that surprised me, but in theory they could do relines of dentures, but that's a grey area, and we need help for the GDC with that, which is very rarely forthcoming. And to learn how to do it, obviously I can show people how to do it, having never done it myself. The product arrived just as I was finishing work, but it's been used in Japan for 70 years and used in the States and Canada for 9 years. And it's explained how to do it on YouTube here. So you can go onto YouTube and learn how to do it there. And these are brilliant. And I had permission from McLean, I'm trying to remember her name, it might be Jeanette McLean, but the videos that she shows are just fantastic because they're actually working with children who aren't and they've got wiggly tongues and it's a little bit wet. And this is the solution, is that, so how do we know if they've got decay or not? Well, we can use a camera, and the type of decay that children have, if it's caught early, it'll be primary decay, which is what this article was about that came out at the beginning of the month. And this is a more expensive camera that hygienists use in the States for teledentistry, and they have a teledentistry platform there that we could easily do here. They're not importing it at the moment, and if they do, obviously the platform will be a lot more expensive, but we could do it really cheaply. And this is the scanner. The interesting thing about scanning is some of the more expensive ones, like the one above, which has now come down in price a lot. I think one of the versions might still do caries diagnosis in a month or so's time for £10,000. The one below is £7,000, and that includes the laptop it would come with, but I'm not sure if it does caries diagnosis. And these are the prices. So the cost of the scanners, well, the top one, or the iTero that everybody uses for Invisalign, they cost about 30,000, and the one at the bottom there, that costs 7,000. In the brackets, the amount that I paid, so I had my one and only scanner about 15 years ago, and obviously it cost a lot more and was a lot more fiddly. And the camera, the same with the camera. The first camera I got that was any good, that's how much it cost, and that's how much the mouthwatch camera costs. And for caries diagnosis, I used a Diagonodent that came with my ozone machine, and it was brilliant because it made a noise. So if it didn't make a noise, it meant the tooth was sound. If it did, it meant there was decay there, and then I'd apply my ozone. But now I'd apply the paint. I could have saved myself 12,000. Anyway, I'm not whinging. And these are the price of the material now. So at the show I was asking how much it would cost and really how we can apply it. And there are a few other different companies to do this, but this is, this is an excellent material and it's easy to apply. But as a dentist, well, they want to earn a bit of money, and as we all do. But so do nurses, and nurses come a lot less expensive. And quite frankly, most nurses are a lot better with their communication skills than dentists. And they're a lot less scary. Anyway, and it's been done before. So the other cost is getting access to schools and how much it's going to cost. This person's doing it, from what I can gather, for free, and the goodwill of people. Well, we can't continue with a system that's free and relying on people goodwill. We all pay into the health service, so we should get something from it. And the under fives was the one thing that Matt Hancock mentioned when he talked about prevention being better than cure. But it didn't really apply for teeth if you're over the age of 5. So that's what I'm trying to fill in the gap. So this particular person, if you go into YouTube, onto my website and type in Magic Dentist, you'll see what we're trying to achieve, and you'll see Nikki there. And also if you type in copy dentures, you'll see the other pitch that I was doing, which is the main one. I'll include the pitch for my app. And when it comes to savings, which is what you're interested in, you've already got the figures. So these are just repeating the government figures. And yeah, for references, just look up Cochrane, the Cochrane Review. I haven't done a course on it, not a course, I haven't done any research on it. There's no need for me to do it, but everybody asks me to do my own research. They ask me to do my own teledentistry research. It's nuts. This is how much you would save according to the government's own figures there. Now clearly it's not going to be all of it, but some of it. Even if it just saves 1 million, well, you could give me 1 million to do my app. But this is a lot more. I mean, I had some teeth for general anaesthetic when I was a kid. It wasn't great. It tends to put you off a bit. But the more we talk about prevention, and we can do an awful lot. When a child comes in, they should be seen regularly at the dentist. Have a quick look. Everything's fine, Johnny. You're doing great. Going through your diet or on your exercise, and just chivvy them along to the age of 18. So at that age, they know what a good diet is. They haven't got any restorations in their mouth. And if they do get restorations after that, then that's fair enough, start paying. Yeah, it's a core service. God, that seems like a good idea.